So, when speaking to a patient about an altered state of consciousness, I believe an anthropologist would ask many questions to try to diagnose what the patient was having. I believe one of the questions would have been like, "What did you see?" And I believe the patient will respond with the images or anything that they could remember, if they did remember anything. A lot of the times it's like during a ritual or during a hallucination or possession, and they do see things and feel things as well. So I believe that's going to be a very great question to ask a patient when trying to diagnose the patient as well with altered state of consciousness. So going along the lines of a hallucination or even a possession or something of that sort, the patient may view their body a little differently. Like if they look at their hands during a hallucination, it might look a little strange or very various patterns on them. So they can ask, like, did you view yourself differently while in that altered state of consciousness? Following that question, you can even ask, an anthropologist could even ask the patient if they have experimented with any drugs ever, because a lot of the time during these rituals they are experimenting with drugs, alcohol, or anything like that that causes them to hallucinate or anything like that. One that I feel like may be a little too much to ask, but also get them on the right track, would be to ask the patient if they practice any religion. Because if that's the case, there can be a lot of different reasons why they were put in an altered state of consciousness, but even not. But it's still a great question to ask when trying to narrow down the cause of an altered state of consciousness for a patient. In Indian voodoo culture, there is a ritual that is performed by an ungun and a mambo. The ritual is to connect with Loa, and Loa is a spirit that possesses the body of the person performing the ritual. The ritual involves many of the participants and to bring offerings of their favorite foods, their favorite tobaccos, perfumes, and is always involved with drinking alcohol. The participant who is going to connect with Loa and be possessed by Loa is going to be very intoxicated, because Loa is said to really like alcohol and possesses the body when the body is drunk and intoxicated.